Hello, ma'am.
Okay, so I will discuss with the common record keeping forms. So I'll be sharing my slides now. Okay, is it visible? Yes?
No, ma'am. Yes,
Yes,
ma'am.
ma'am. Yes, ma'am.
Yes, ma'am.
Okay, so when we say common record keeping form means these are those methods or ways how we used to do the recording. Okay, are the different forms. Like even in a hospital, if you see, we have so many different forms that we maintain. Like for example, when the patient comes during admission, you must have seen the nursing initial assessment. That is also one form. Then we have various flow chart. Flow chart means like flow sheets, sorry. Like for example, your TPR chart, I think you must have seen. Okay, you have also fill up also, I think, your TPR chart, your medication chart. So all these comes under flow sheets. Then we have your nursing care plans. So these are various type of forms, okay, which we use to keep a record in for the hospital. Okay, in a hospital for any patient care or any activity that you have done for the patient, so we need, obviously we need to record that. So where we'll record that in this various type of forms. Okay, so if you see the first one which comes is the admission nursing assessment. So this also all of you must have seen whenever initially whenever any new patient comes for admission. So the first thing we need to do is to do the initial assessment. So in the initial assessment we took the patient's information history, then we do physical examination, head to toe physical examination, or even when we say head to toe, or even sometime we do it in the system wise. Suppose you start with the uh, this one digestive system, circulatory system. Okay, so system wise also ways to do the recording. Okay, so what is there under this assessment? First of all means the initial database. Okay, so when we say initial database means the patient's, okay, what is presently what is a patient's height, weight. Okay, then what is his BMI, okay, or the body mass index, then what is his present chief complaints, okay, previous history, whether he have any previous medical surgical history, okay, family history, and whether the patient was having any form of allergy. Okay, so everything comes when we say in the first part of the nursing assessment. Okay, then next is the whenever we organize any nursing initial assessment, okay, we try to organize it to keep it in a very well organized manner so that it becomes very easy for us also to do the assessment, as well as it will be easy also for the person who is assessing that file or that records. Okay, so sometime whenever we organize, sometime we organize it according to the body system. That means when we do the head to toe assessment, we follow the body system. Okay, suppose it can be head, the neck, the chest. Okay, or even the other way also we can do head, neck, then comes the digestive system, the cardiovascular system. Okay, then your this excretory system. Okay, genitourinary system. So all this, it is being organized. Then next is functional ability. Whenever we say functional ability is the condition of the client, whether he is able to perform his own activities by himself, okay, whether he is partially dependent on others, or he is totally dependent on his family members or even the nurse, okay, or even the physicians. So all this comes under functional ability, okay, whether he is able to perform his duty by himself or he needs others' help. Then health problems. Okay, what is the current health problem of the client? What are the main chief complaint he's having at present? Okay, then risk. Okay, so whenever we say risk means because obviously whenever a patient comes to the hospital, so he's also exposed to so many risks. Okay, so if especially if the patient is already having any previous history of suppose a patient who is coming, who is having diabetes. Okay, he's having so many health condition risks along with him. Okay, so anytime he might have, if his blood sugar becomes very high, again he might have damage of the retina. Okay, he might have so many other complications. So not only that, suppose a patient who is not mentally stable. Okay, when he is admitted to the patient, if you don't take care of the patient properly, if you don't monitor him properly, he might do so many physical harms to himself as well as to the patient, as well as to the attendants. or to the even to the nurses and doctors. Okay, so all this risks we have to see. The nursing model or type of healthcare system. Okay, so type of healthcare setting means it either it is a hospital, or it can be your some sub centers, primary health centers, or it is whether it is only a home health nurse. Okay, okay, so all this comes under the setting. So this is one example of nursing initial assessment. Okay, so if you see also in a hospital, we also have a very detailed nursing initial assessment that we followed. Okay, so this is just an example here. You can see it have everything. Okay, head to toe assessment. Who is the one conducted the assessment? LOC means level of consciousness, okay, whether the patient is alert, drowsy, lethargic, okay, stupor. Coma means totally the patient is not responsive, okay, or response. Then orientation, whether the patient is able to recognize the person, place, time, situation, means then vital signs. Okay, then comes the all the different body systems. You can see head, neck, chest, abdomen. Okay, then upper extremities, lower extremities. ROM means you all know range of motion. Okay, then general assessment, height, weight, which I've also said. BMI, okay, the body mass index, this is also very important. Okay, so because as you know, there are so many health conditions which is also related to obesity. So if the BMI becomes very high, so immediately we will know that this person is obese. So we need to plan out something. Okay, we have to plan out his diet and make his patient a bit, okay, physically active. Also we have to keep him. And pain assessment, because obviously whenever so many patient comes to the hospitals with a chief complaint of pain. Okay, so we have to do the assessment of pain. Okay, so by using the pain scale, I think all of you also they are familiar with the pain scale. Okay, then skin assessment, this is very important, especially if the person is bedridden type. So as you know, bed sore is one of the main complication of, okay, bed, if the patient is bedridden for a prolonged period of time, so he might have bed sore. So because of that, time to time we have to do this initial skin assessment. Okay, this is also very important. So this is just one type of form, okay, which we kept in the for recording. So the second, it is a nursing care plan. This also I think all of you know. Okay, so we have actually two types of care plan: the traditional and the standardized care plan. Okay, so whenever we say traditional care plan, so this is one example of a traditional care plans. Here indirectly they have the problems, okay, or the needs. That means this is the main, it is somehow similar to the nursing diagnosis. Okay, this, how do they make this? After doing the assessment. Okay, then the goals, then the interventions. Then this is a standardized nursing care plan. Okay, so in standardized nursing care plan, there are also some nursing care plan which are standardized, okay, based on some common health condition. For example, like diarrhea is a very common health problem seen in many patients. Fever, okay, then pain. So these type of condition, we can prepare the nursing care plan beforehand. Okay, so if so those type of care plan which are already ready-madely they are available, so those type of care plan we call it as a standardized. Okay, and these standardized care plan, we can make it prepare beforehand for some basic common symptoms. Okay, the next is the card access. Okay, so this card access I think might not have seen. Okay, since we have not had your any. So, but here what happened in this card access, it is like in a very big sheet of paper. Okay, and in this single sheet of paper, you will be filling up all the details, starting from the patient's identification, then what type of medication he is getting, what type of treatment he is getting. Okay, then whether what are the investigation done, what are the future plan. So in this card access, actually, it is a very easy. Okay, when in one go, okay, by just looking at that one big sheet, you'll be able to get so many information at once. Okay, so we don't fill up in separate pages. So in one big sheet, okay, we fill up everything related to the patient care, okay, patient health conditions. So these are actually very commonly used in ICU setting. Okay, so it is very widely used, concise method of organizing and recording data for very quick references, and series of cards in index file on a computer generated form, or it's usually there for each patient. Okay, so it can be either in the computer form or sometimes it can also be in the written form. Okay, so but mostly we are following this as in the written form. Okay? So it might be
Asa
temporary or
mas condition
permanent
morning
watching.
anda ba isu?
Please mute your microphone, Alicia. Then what are the information which you can organize in this section? So first of all, you can put the patient's information, list of medication, list of daily treatment, okay, list of diagnostic procedures, ordered, specific data on any client needs, okay, what is his present health condition. So based on that, the problem list, goal, approaches means what are the interventions or the planning that you have plan for your patient after identifying the various problems. Okay, so this is one example of the Cardex form. Okay, as you can see, this is very different from the previous form. So in one form, we fill up everything. If remember, like in a patient, if you have remember when we ever we have a patient file, so usually we have different sections where we fill up, suppose TPR chart we have, then we have infection control chart, we have medication chart, okay, identification chart. So these we have in different chart. But here in this type of form, in one form only, we fill up everything. So it's very easy to get the information. It means within minutes you'll be able to get all the details about the particular patient, okay, when he is admitted, what was the medication given, okay, what is the future plan. So all this we can get it in one go. Okay, so as you can see from here also, we have the patient name, his address, his medical number, means the IPD number and all, then date and time when he is admitted, what are the chief complaints, then what are the date ordered, okay, shift means it can be morning shift, evening shift, okay, then what are the IV fluids he's getting, what medicine has been infused, date and time when it was administered, okay. So all this, even if any blood transfusion is there, then when it was given, then what are the medication given, parenteral medication means IV medication and all, whatever is there, or oral medication if the patient is receiving. So what are the treatment. So and not only that, even if you see in the last column, okay, last row, so what are the laboratory investigation done, okay. So this, it becomes very easy, okay. So because especially, as you know, in ICU the patients are very critical, okay. So by keeping this type of form, it becomes very easy for the nurse as well as for the healthcare, whoever is dealing with the patients. So in one go only, they'll be able to get all the information. It becomes very easy, okay. So this is another form of recording. This is called as a Cardex form, okay. So I hope everyone is clear, okay. So by far we have discussed about three type, okay. So the traditional care plan, then the nursing initial assessment, and this is a Cardex form, okay. So the next is a flow sheets, okay. So flow sheets are nothing like these are those uh, sheets like whenever that we maintain, even at present in so many for so many patients we are maintaining, like for example, like your TPR chart, okay, medication chart, then intake and output or the fluid balance charts, all those are flow sheets, okay. So this, it records the data very quickly and concisely, and it is also very easy to read as well as record. So for example of some flow sheets are like graphic record, like means your TPR chart, okay, fluid balance, then daily care record. This also we are maintaining daily. If for every shift, we always maintain our daily care record, be it your doing of the bed making, checking of the patient's positioning of the patient, changing of the patient position, which is very important, okay, in case of bedridden patient, or any care which you are providing to the client, okay, or to the patient. So we record it in the daily care. But what are the medication okay, record, that means what were the medication given, date, time, okay, then signature of the person who have given the medication, skin assessment record. So like I've said, this is very important for those patients who are totally bedridden. So time to time we need to do the skin assessments to prevent bed sore, okay. Then progress notes, okay. So progress notes also, if you remember, even in yesterday's class I have discussed about the various formats which we can do the recording of the progress notes. Like for example, if you remember, I've talked about SOAP, okay, which is, or SOAPIA, okay. SOAP means a subjective, objective, okay, then assessment, planning, and I stands for intervention, evaluation, and revision, okay. So these formats we can follow. We can also follow the DAR methods, which is the data, which means the subjective and objective data, okay. So A means the action and R is the response or the evaluation. So these type of progress note also comes as, I guess, the different forms where we can do the recording, okay. So this is a nursing flow sheet. This is And not only this, okay, if you remember, even in our hospitals also we have those different various CPR chart, and also this also counts as a flow sheet. Okay, so the next is the nursing discharge or the referral summaries. So are you aware of what is the meaning of the word referral? Yes or no? Any one of you? What do you mean by referral? Yes.
Ma'am, transfer to another hospital or
Yes, do you know what do you mean by referral? Please answer, anyone. If you don't know, just say you don't know.
ma'am, transfer to another hospital or
Yes,
doctor.
very good. Okay, so referral is like we transfer a patient from one hospital to another hospital, because sometimes what happen, some hospitals are specialized in some specialization. Some hospital are specialized for cardio, some are specialized for ortho, some must be for cardio. Okay, so what happens? There are sometimes that the patient's health condition becomes very worse, so we are unable to manage that patient in that particular hospital. So in order to save the patient's life, we need to transfer him to another a good specialization which is specific to his problem. So that type of method of transferring the client, okay, from one hospital to another hospital, or even we transfer even within the hospital itself, we transfer from one ward to another ward. So those type of methods, we call it as a referral. Okay, so it is very important, because whenever we refer any patient, we don't just send the patient just like that. Okay, so we have to write a very detailed, we have to send a very detailed summary, okay, of what is the present condition of the patient, why do you refer the patient, what is the criteria for referring. Okay, then in between the referral also, what things you need, because we cannot just send the patient just like that. There are some patients who are very critical, so sometimes in between sending, we have to also see, maybe they might need oxygen, okay, or they might need some specific treatment while transferring. So all this thing we have to keep it in the referral summaries. Okay, and discharge, so I think every one of you are very familiar. Okay, whenever a patient goes for any discharge, we always prepare discharge plan. Okay, so discharge plan. Okay, so in whenever we write a discharge plan, if you remember, we always note down what is the present this one condition of the client. Okay, what were the progress notes, what were the medication that needs to be continued. Okay, and what are the instructions, if any. Suppose a client, he has been admitted with a history of fracture. So obviously when the patient will be discharged later on, there will be some instructions will be provided, suppose like limitation of movement. Okay, so that this one affected area, okay, he might be getting a plaster cast, or when he have to come back to report in between, because some complication might occur, so contact number needs to be given, who to contact. Okay, so all this instructions needs to be given in the discharge summaries. Okay, referral summary also, we have to also keep a detailed summary whenever we refer any patient. Then what are the things which you need to include in a discharge plan? Okay, so first of all, description of the client status is very important. Okay, and if the patient, there are some situation also where the patient also leave against a medical advice. I think you have heard of LAMA. Okay, so in that condition also we have to specify. Okay, so what are the resolving health problems? Because when a patient comes to the hospital, they might be coming with so many health problems, but whenever patients go for discharge, so we have to write down, note down what were the problems that were present during the admission, but now they are resolving. So all those also we need to mention. Okay, unresolved health problems, because it doesn't mean that just because a patient comes to the hospital, whatever problem he have, it will be resolved, because there are certain health problems which it is also it might not be improving. So in that condition also you need to specify those. Then what are the treatments being provided? Okay, starting from the medication, what were the laboratory investigation done? Okay, what are the future plan for treatment follow up? Okay, what is the current medication that the patient is taking, and what are the medication that he still needs to continue. Restrictions, okay, like for example movement restrictions or diet restrictions. Okay, so all those, traveling restrictions, all this also comes here. Then support network, when we say support network, these are some, like suppose in between, if a patient who is mentally unstable, okay, when he is admitted to the hospital. So later on also he might still needs help, okay. So we have to see if there are any NGOs which are running related to mental health, okay, or if there is any support group within the community. So all these also we need to see, and we have to give the contact information. Then clients and education provided, because obviously this health education also asks you all, also you have already done last time. So time to time we always give health education. So all those also we need to mention in the discharge summary. What is the discharge destination? That means, well, where the patient will be, this one, where is the patient address or home, okay. Referral services and functional self-care abilities, okay, whether he is able to perform by himself or he needs help from his family members, okay, totally or partially. Then comfort level, okay. So this is just one example of a discharge summary. So I think discharge, you all are very familiar because all of you have already seen, okay. So everything is included here, and also we always take the signature of the patient if possible, or the attendant guardian, okay, that is very important. So this is about the different forms of common forms which we can use for recording, okay. So are you all clear? Do you have any question till now? Yes or no?
No, ma'am.
Okay, so just be very clear, okay. We have 4 main forms, okay. The first is the initial assessment, okay, which includes all the patient, this one, identification, okay. And this initial assessment also, we organize this in various sections, okay. So had all the, in the form of body system, okay, what are the function ability, okay, what are the treatment, so what are the chief complaints, all those comes under that. Then the nursing care plan, this, so I think everyone knows, okay. Then in nursing care plan also we have the traditional methods as well as the standardized one, which has already been prepared, or the ready-made one which we can follow, okay, in every for every common symptoms. Then we also have the Cardex form, okay. So in Cardex form, if you see, in one form we have in one big sheet of paper, so there all the details can be filled up. So it is very easy for references, because in one go you can get so many information, okay, and you don't have to flip through so many pages to know about the patient's health condition and all, okay. And also we have this uh, discharge summaries, okay, discharge plan also. These are the various methods which we can fill up, okay. And that's as well as a referral. And we also have the flow sheets, okay. So flow sheet means like your vitals, okay, vital record, TPR chart, your fluid balance, and medication record. So all these comes under the flow sheets. So other than these also we have various forms, okay, where we fill up for recording, like, but these are the most common one when it comes to the for the nurses, okay. So I hope everyone is clear with this.
Yes, ma'am.
Okay.
Yes, ma'am.
Okay, anyhow, if you have question, please, okay, you ask me now, or everyone is clear?
Yes, ma'am.
Okay, okay. Okay, then thank you, everyone.
Thank you, ma'am. Thank you, ma'am.